Welcome to Conversations Live. For more than a decade, we've brought you the best in books, entertainment, celebrity interviews, and current events. When the movers and shakers of the world have something to say to you, they say it to us first. Here's your host, Cyrus Webb.
And welcome back, everyone, to Conversations Live. I'm your host, Cyrus Webb. Glad you all could join us once again, both for our radio audience here in Mississippi at WYAD 94.1 FM and WYADonline.com. We're glad that you all could be with us. Also, just joining us are online affiliates around the world, including iHeartRadio and Amazon Music Podcasts. We're glad you all could be with us as well. This is part of our For Your Health segment, and it's information that we try to be able to share with you to be able to make yourselves better and more informed, both for mind and body, and then, of course, that you can be able to share for others as well. If you may be at a higher risk of heart attack, stroke, or even losing a limb, if you live with something called Peripheral Artery Disease, or PAD. PAD is the leading cause of amputations worldwide. An estimated 20 million Americans live with PAD, yet only 8.5 million are currently being diagnosed. Here to explain why it's important to identify PAD early, we're excited to welcome Dr. Geoffrey Barnes to our program today. Dr. Barnes, really appreciate you stopping by the show today.
Hey, thanks so much for having me, Cyrus. I'm really excited to talk about PAD.
Well, look, I appreciate this. I've seen the commercials talking about peripheral artery disease, and I'm sure our audience have as well, but what exactly is it, and who does it, in fact?
Yeah, that's a great question. So peripheral artery disease, or PAD, it's a chronic condition of the blood vessels where the blood vessels, especially those in the legs, tend to narrow. And when those blood vessels narrow, it makes it harder for blood to get down to the muscles of our legs or even down to our feet. And so people tend to have poor blood flow down there, which can lead to all kinds of different complications. As you mentioned, this is a pretty common condition. In fact, we think about 20 million Americans have this, but unfortunately, less than half of them know they have this condition. So it's often underappreciated, and it's something we need to really raise awareness of. That's particularly true in certain segments of the population. I'm thinking here about Black Americans. We know that Black Americans are at much higher risk for developing PAD. They tend to get diagnosed at a later stage, and unfortunately, they have a 4 times higher rate of amputation than white Americans. So we really need to make sure that that group of people are aware of PAD and are getting appropriate screening so that we can get them treated.
That's so important, Dr. Barnes. So talk to us a little bit about the signs, because unfortunately, especially for us guys, we don't always, do our regular checkups. I've now gotten, as I'm getting older, I've gotten better about getting my yearlies, and I've encouraged our audience to be able to do that too. But what are some of the early warning signs our audience should know about when it comes to this condition?
Yeah, that is so right. A lot of people don't think about getting this checked out. There are a couple things that I tell my patients to look out for. So the classic story would be somebody who has leg cramping or aching when they walk or exercise that maybe gets better when you rest. But oftentimes people will tell me about numbness or tingling. Sometimes they'll use that phrase, pins and needles, maybe in their feet or lower legs. I'll even have people tell me that they have a sore on their foot or on their toes that just doesn't heal. But I'll tell you, one of the most common things I hear is folks come into my clinic and they say, I just can't keep up with my grandkids anymore. They want to run around and have fun, but my legs are just too tired. Or I can't go grocery shopping without sitting down or taking a cart or a scooter. Those are the kinds of things that people often will tell me about that then makes me think, could they have PAD?
So, and I appreciate you sharing some of those signs. So if left undiagnosed or untreated, then, Dr. Barnes, what impact could this condition have?
Well, it can have a number of different impacts. So the first thing to remember is blood vessels sort of go all throughout the body. And so if you've got a blockage in blood vessels of your legs, it means you could also have a blockage in a blood vessel in a different area, such as blood vessels of the heart or blood vessels that go to the brain. So when we don't treat PAD, we know that people are at increased risk for heart attacks and strokes. But then, of course, those blood vessels that are blocked down to the legs, if that gets really severe, those people may even require an amputation. In fact, PAD is the number 1 cause of amputation across the world. And we know that when people have an amputation, if they lose part of their foot or part of their leg, that really impacts their quality of life but it also increases their risk of death. So it's definitely something we need to be looking out for. And so as I talked about before, if you have any of those signs or symptoms, especially if you have risk factors like smoking, we know that smoking, whether it's current smoking or former smoking, those are really big risk factors for PAD. We need to get in to get you checked out, get you screened so that we can start treatment.
I really appreciate this, Dr. Barnes. I want to ask you, and I think what you just said is so important, but what is the most important message you want our audience to take away from this when it comes to understanding what peripheral artery disease or PAD is, and also what they should be on the lookout for? Yeah,
I want you to remember a couple key things. First is I want you to know what PAD is and if you might be at risk for it. Again, thinking about the smoking risk factor, thinking about the leg pain or the just can't keep up. The second thing I want you to remember is go in and see your doctor and talk about this. A great way to get that conversation started when you're going for your next, checkup with your family doc or your heart doc or your diabetes doc is to take off your socks and shoes. That lets the doctor look at your feet, feel for those pulses, and it helps you start that conversation about whether or not you might have PAD. And then if you want to learn more, there's this great website you can go to. It's vascularcures.org/PAD. And there you'll learn more about what PAD is, how we diagnose and treat it, and importantly, it'll give you the information you need so that you're prepared to talk to your doctor and ask these important questions.
Love it. Again, everyone, Dr. Geoffrey Barnes has been our guest from the University of Michigan's Frankel Cardiovascular Center, talking with us about not only, of course, the importance of knowing about peripheral artery disease or PAD, but also why it's so important for us to make sure we're having those communications and conversations with our doctor. Dr. Barnes, thank you so much for the work that you're doing, and looking forward to having you back on the program again.
Hey, Cyrus, thanks for having me.
Glad to do it. And we thank your audience for tuning in to another great segment of Conversations Live. Until next time, I'm your host, Cyrus Webb, saying as always, enjoy your day, enjoy your life, enjoy your world. Thank you all for choosing Conversations Live. Now let's go make today amazing. Take care.